thank you for joining us, the Superior Health Quality Alliance Nursing Home Leadership Roundtable event. Today's topic is All in a Day's Round. My name is Constance Tetriv, and I am a Quality Improvement Advisor with Superior Health Quality Alliance, and I am joined by a few of my colleagues. Tabitha is not here today, but Keisha Plesko is here, as well as our guest speaker today, Kim Heff, a Quality Improvement Advisor that has been on the Roundtable Committee for the last 2 years, so you've seen her face. We host these 1-hour sessions on the second and the fourth Wednesday of the month. The first half is a didactic presentation, then the remaining time will be for questions and answers. The PowerPoint presentation link will be dropped into the chat momentarily. Please use the chat box to share any comments, questions, and even resources during our presentation. Besides learning from our speakers, we learn from each other and our peers. Many of you have shared resources and strategies, and we appreciate you and encourage you to support each other through the hour we have together. Towards the end of today's event, we will also put an evaluation link in the chat that will take only a few seconds for you to complete, and we use your evaluations to help us give you a better experience. We want to tell you about the 2024 series invite that has been emailed to all of the nursing home leaderships. If you haven't received it, you can register using the link in the chat, the Zoom registration. We will be starting our 2024 series off on January 10th with Dr. Paul Kilgore. He will be presenting on the respiratory infections of the season and practices to keep residents and staff infection-free. Dr. Kilgore has been working in Detroit, Michigan's skilled nursing facilities since the start of COVID, and he also worked with professional societies and public health agencies at the state and local level to implement tools for education of frontline healthcare providers with the goal of improving both worker and resident safety. He's developed numerous tools and conducted on-site educational programs in SNFs, as well as conducted outbreak investigations and performed point prevalence surveys in skilled nursing facilities during and after the COVID-19 pandemic. Okay, let's get started. The floor is all yours, Kim.
Hey, yeah. Hello, everyone. It's nice to see all of you again here on another Superior Health Roundtable. Roundtable, right? Well, we're talking about rounding instead of round tables. And we have all heard and used this practice in our workplace, but are we using it to our greatest benefit? Are we doing it enough? Are we doing the right rounding types? Are we asking the right questions, looking at the right areas? And what do we do with our findings? What does this all even mean? So today, we're going to explain rounding with purpose. We're going to discuss some different types of rounding. We're also going to talk about key elements to effective rounding and provide examples of focus areas that we all should be looking at one time or another in our nursing homes. And then lastly, we're going to provide a conversation. We're going to talk about writing about rounding items that you might be struggling with and possibly come up with some strategies to help resolve and sustain them. So rounding is a tool to gain information from residents, staff, families. Your information is also gained by what you observe during any type of rounding, right? What you see, what you hear, even what you smell. So during rounds, we are given the time to educate, reinforce consistency of standards, and this is your time to shine. This is your time to model leadership behaviors and skills. And rounding gives us the opportunity to be proactive and reactive at times, right? We focus on resident safety and quality of life. This is a chance for us to connect with staff, and it also gives us, this is the time for survey prep, depending on the time of year that you're in. So what is purposeful rounding? Purposeful rounding is a proactive, systematic, nurse-driven, evidence-based intervention that helps us anticipate and address patient needs. When you apply this to nursing, rounding is often described as hourly or purposeful. we have to add that purposeful in there because sometimes it's not hourly. It could be at different times. So purposeful rounding. Of rounding that I talk about today, they're not inclusive. I'll discuss certain rounding types that can be useful to you based on your home's needs. So research has identified hospitals that have successfully implemented hourly rounding have significant decreases in adverse patient events with improvements in patient and staff satisfaction. Basically, it's a win-win for all of us. In a study of 14 hospitals, hourly patient rounding revealed the following improvements. There was a 12% increase in patient satisfaction scores, a 52% reduction in patient falls. Man, that's huge. A 37% reduction in call light use, and a 14% decline in skin breakdowns. I do like this addition here that one hospital measured a 20% reduction in the distance walked each day by the nursing staff. I think your staff would like to hear about that one. So when healthcare teams, when your organizations, when they're committed to building a positive, resident-centric culture, team members can carry out their rounding and resident duties more effectively. So what comes out of this is called a culture of safety. The core values and behaviors that come about when there's collective and continuous commitment by leadership, managers, and staff to emphasize safety over competing goals. So rounding promotes a culture of safety through promoting a safe work environment, checking on all your equipment, possibly reducing behavior processes that you found along the way, providing a focus. It's about providing that focus on resident safety and resident assistance. Also identifying issues and deficiencies before they develop into safety events, demonstrating a commitment to change, and reducing patient falls, infections, and pressure ulcers. I spoke a few slides ago here about purposeful rounding being a proactive and systematic event in helping us to anticipate and address resident needs, okay? So to help support this definition, the 5 Ps of hourly rounding are frequently used by staff every time they leave a resident room. What are they? Pain. Ask the resident about pain. Ask them, are they positioned properly? Are they comfortable and are they safe? Offer them toileting or incontinence care and assistance as needed. Their possessions, right? Is that call light in reach? Do they have a Kleenex box, their TV remote? Plugins. Plugins would be, is their equipment functioning properly and in place? So their oxygen concentrator, maybe their alarms, anything that keeps them safe, ensuring their safety, bed in safe position, fall prevention measures in place. So here's a way that your staff can put the 5 Ps into action. Ask that resident before you leave, is there anything else I can do for you? Asking the resident specific questions helps reduce their anxiety, it gains their trust, and also helps your frontline to be more efficient when caring for the residents. You said the question, is there anything I can do before I leave? Add a couple more lines to that. Are you feeling hot or cold? Would you like your blinds open or closed? Sometimes a resident needs just a little bit more prompting to realize there is something that they need and that they can be helped with before that nurse or CNA or whomever leaves the room, then not having to put their call light on again. I encourage you to use this sentence instead of, I'll be right back. I'll be right back. I have to say, I'll be right back sometimes never happens. So is there anything I can do to make you more comfortable before I leave is a much more effective manner. So here's my question to you. Is purposeful rounding for just the frontline staff? Everyone that works in your home most likely is going to encounter a resident, whether it's in a room, a sitting area, dining room, hallway. So as nursing home leaders, what are your expectations from staff when they encounter a resident and leave them? Does everyone from nursing to the business office ask the resident, is there anything else I can do before I leave? Is this part of your culture of safety? So we're going to move on to leadership rounding with a resident focus. So members of the leadership team, they make rounds to interact with residents and their family members. Now, this helps leaders to directly understand resident experiences, identify potential areas for improvement, and ultimately make decisions. Leadership rounding focuses on improving resident satisfaction and quality of care. Leadership, you can sit in on care conferences, attend resident council, visit during meals, and of course, do rounds to resident rooms. Residents and families want to be informed, heard, and supported. Asking residents and families about what is going well and not so well improves communication and it builds trust. Conducting resident-focused rounding can also support quality of care for residents before vaccination clinics. I'm saying that right now because I know many of you probably have finished your influenza vaccines, but now there's a good chance you're working on COVID-19 vaccinations. This is a great time for leadership rounding, resident focus, having leadership talk to residents and families, going room to room, maybe having to do one-on-one during rounds. It gives you an opportunity for them to ask questions and for leadership to use your motivational interviewing skills to promote vaccination. This also, of course, applies to employee rounding, but we'll discuss that a little bit later. To influence, we're going to take a minute to talk about this. It's not quite the same thing as leadership employee rounds. That's where leaders go to resident units, visit with staff to gain a better awareness of safety issues and build relationships. Rounding to influence, it's much, much more focused. It's one element of an evidence-based bundle of leadership methods used in highly reliable organizations. It's brief, focused, and scripted. It's not just about leaders being seen, it's about what leaders are seen doing and asking. So here's an example of how to put rounding to influence into action. And you can do this with any project that you're working on. So let's say you're working on a plan to reduce falls and improve the safety culture in your home by initiating purposeful rounding on one unit. It's going to be your pilot project before you go full house. Education was provided on all shifts with competency training. Everybody's good to go. So using rounding to influence, your nurse managers round the unit regularly, perhaps daily, probably even Q shift. Your director of nursing might do it weekly, your nursing home administrator monthly. You're all doing this to assess the effects of purposeful rounding and reducing resident falls. Now, this process involves about a 5 to 10 minute focused and scripted conversation with your frontline staff. Just CNA or a nurse, whomever, and ask them for a few minutes to talk about improving safety culture through purposeful rounding. Start by briefly describing how purposeful rounding, decreases resident falls and it does improve resident outcomes. Maybe you can even add a stat about, there's a 52% reduction in falls with purposeful rounding. So you got their attention. Then ask the CNA questions on purposeful rounding. such as how often is it done? And what are the 5 Ps? And what do you ask residents before you leave the room? So if the CNA doesn't answer your questions correctly, well, you just learn you have a process gap in your training execution. But now you also have the opportunity for some one-on-one training and education. Now, if they answer correctly, ask them which part of purposeful rounding is most difficult to implement. Listen to their answers. Maybe they tell you it's difficult to round during lunchtime. There's not enough staff to cover. Well, have that conversation on how to address this barrier with the CNA. And of course, make a note to address this with the leadership team to identify ways to remove this issue. Next, ask the CNA, is there a staff person on the unit who has implemented purposeful rounding exceptionally well? That's the person you're going to want to talk to. And then ask that CNA, can I have your commitment to make purposeful rounding a habit? And please, you have ideas for how we can improve your ability to do so reliably. Thank them for your time. Well, I hope they say yes, by the way. Thank them for your time. Move on to the next person. Consistency, brief, focused, scripted interactions. So about after 12 weeks of these rounds, chances are good that 3 things have occurred. Operational barriers to implementation have been removed, such as that issue with rounding during lunch. The staff's sense of accountability for implementation have dramatically decreased, and reliability of purposeful rounding will have improved. Again, you can use this with anything you're working on. I told you we get to employee rounding. It's the single most effective tool for making employees feel heard and appreciated. It's a proactive approach in which leaders personally interact with staff to gather valuable insights to what is and isn't working in an organization. This is where during rounds you may be asking questions like, hey, what's going on? What's working well? Do you have everything you need? What kind of resources are most effective in supporting your job? Is there anything you'd like to share about your work-life balance? That could be a good one. How do you describe your overall satisfaction? I like this one, though. Who on your team deserves recognition for a job well done? During employee rounding, acknowledge hard work and dedication. Look for exceptional resident care. Like Joan's hair today. Oh my gosh, it looks wonderful. Reinforce those positive behaviors. You have a problem with getting those your cabinets locked in the shower room? I had that once. You see that it's locked? Hey, nice job on locking that shower cabinet, keeping those residents safe. So employee rounding provides an opportunity to directly connect with employees, offering a platform for open dialogue and for feedback. I'm going to get off a bit on topic of rounding, and I want to focus on recognition. This is one of the best ways to engage and inspire employees is to recognize them, which leads to employee retention and reduction in staff turnover. And I know we're all working on that. Agree that recognition is an important part of their organization. They're like almost 4 times as likely to strongly agree that they feel connected to their culture. Among employees that have great recognition experiences, 72% say that performance on little things is commonly recognized at their organization. And employees who receive great recognition are 20 times as likely to be engaged as employees who receive poor recognition. This is where we all want to be. This culture. Yeah, how we do things around here. I think I've said that myself. That's how we do things around here. It's a system of various forces at play within an organization, or in terms that describe its primary characteristics. We're like a family, but we're very performance based. It's how people within the organization, how we interact with each other and how we get work done. An organization's culture clarifies what its employees as well as its customers can expect when they interact with one another. Or not even rounds, but when you're in meetings or you're in care conferences, resident council, whatever it is that you are, what kind of do you frequently hear from your staff, residents, families, even your peers, leadership to leadership? What does your workplace culture say about your home? Or, do you hear, I work for the most caring and friendly place ever. I love everybody I work with. And you know what? We are so innovative. We figure out problems all the time. Or do you hear things like, oh, it's so toxic here, so unorganized, and they're all only out for money here. What kind of home, what kind of atmosphere, culture do you have? So another type of a rounding is quality of life, safety rounding. I have a tendency to call it clinical rounding. And as a nurse leader, conducting daily clinical rounds, it's an opportunity for the director of nursing or your designated leader to connect with staff and residents, gain valuable information, reinforce consistency of standards. They're also an excellent tool for survey preparedness and a great way to ensure the safety and quality are maintained. The ideal world, the director of nursing may schedule clinical rounds at the beginning, and then at the end of the day, that second round would include follow-up on any items of concern that you noted earlier. It's impossible to look at every aspect of care and services in a single quality of life round or clinical round, but there's ways you can do this. The first focuses on clinical areas where the home has struggled, such as maybe some survey results or a facility reported incident, your quality measure triggers. Examples of these problematic areas, maybe they're falls, pressure ulcers, weight loss. The second approach concentrates on one clinical system each day of the week. So today on Monday, we're doing falls, pressure injuries on Tuesday, infection control, UTI infections, I don't know, on Wednesday. But anyways, the clinical round may involve all residents or a sample of residents, depending on what you're working on, what's your expectations, what's your home's policy. When conducting rounds with survey readiness in mind, select a mock survey sample, maybe about 20% of the resident census, who would likely to be included in the annual survey sample. You know who those residents are. They have all those quality measure triggers, who those surveyors are going to be looking at. Now, this can be done monthly or more frequently. It just depends on the readiness of the home. Briefly, identify some focus areas to look at while doing clinical or quality of life rounds. I encourage you, please feel free to put into chat your focus tips that others could benefit from. Also, Superior Health, QIAs, Quality Improvement Advisors out there, if you also have tips, please add them to chat too. Just want to all learn from each other because I'm just going over some few high level focus areas, which I could never go through in one half hour sitting here. And in fact, I would encourage, if you don't, to have checklists for these different areas so that you know you're not missing anything. So area tips. We'll talk about falls first. Are your devices in place? Are wheelchair pedals on the wheelchairs? And while the resident's sitting in them. But if they're not, are they on the floor causing a tripping hazard? Are your fall mats appropriate for the right residents, or are they tripping on the fall mat? You got to think about that one there. Are your residents and staff, do they have gate belts? Are you using lifts properly? The right size for the resident. If you don't have enough sizes for your slings for the lifts, they're going to use whatever they can find, correct? For pressure injuries, are your preventive devices into place? Is turning and repositioning being done? Are your dressings drying intact and following orders? Check those dressings. Don't be afraid to say, hey, Mrs. Jones, let me just look at your leg real quick. I want to see how it looks. And take a look on the date of that dressing and the signature there. Are we following orders? Residents that have respiratory status issues is the oxygen being delivered at the correct flow? Is the O2 tubing dated? And I don't mean the old date, the new date, and off the floor? Are your concentrators clean? Your humidifiers full and filters being changed? Oh my gosh, your trach site's clean. Inner cannula on the wall. Dignity, privacy during care. We all know about curtains being pulled, doors being closed. Watch out for your blinds on your windows. I got that one once before. Got to always close those blinds. Are your dignity bags, for your Foley catheters, are your dignity bags on the catheter drainage bags? And how's grooming doing? Even for the females with shaving, nail care. Lots of people have eyeglasses. We all know residents, oh my gosh, everybody has eyeglasses, but are they clean? Are they clean? Pain and mood, are your residents comfortable? Are they positioned directly? And are their psychosocial needs met? You may need to go through some of your residents and see if you can come up with an alternative pain regimen for them. And for urinary and bowel, are your residents clean and dry? When you walk down that hallway, what do you smell? Or when you walk into the room? Are your residents being toileted per their care plan? Tube feeding, IV therapy? Lots here on your all of your items that need to be dated, and making sure that sites are free of infection, for infection control, hand washing. We could go on here forever for infection control, but hand washing. I should have noted where I saw this research that was done, but during COVID, hand washing, hand hygiene, we started climbing, right? We're doing really good. Everybody's on board. We're doing our job. It's starting to take a turn downward again. So make sure you're monitoring and doing rounds for hand washing and completing your audits. For linen off the floor, are on the floor. Check your shower rooms. That's always a good one there too. Lastly, again, your focus areas for staff. Do they have what they need to do their job today? Are there gloves in their room? Ask them. They might have ran out of gloves and they can't find anything in central supply, right? Or hand sanitizer or gait belts. What residents? Ask them what residents they're concerned about. You might want to go check them out first. And do staff appear engaged? Are they engaged? The last kind of rounding I want to talk about is environment of care rounding. So according to the Joint Commission, protecting patients from harm involves more than safe treatments and procedures. We must also consider where patients receive care and minimize risks associated with the physical environment. There is a, right here on this link, you'll have it in your slides, there's a nice checklist in there for all of you to look at for environmental rounding that you might want to share with your maintenance director. And yes, exactly, with your maintenance director, because when we think of environmental rounding, sometimes that's what we think of, even though all these things I've been talking about, there's been a lot of environment about what with what we've been discussing. But when we think of rounding, that maintenance director could be conducting fire drills, testing water and room temperatures, testing alarm doors and other things of that nature. But for our purposes right here today, I'm including environmental rounding that the IDT team can identify during rounds. Now, this is just a short list of items that I frequently would look at during my rounds. Items such as, hallways being clutter-free, items on one side of the hall, making sure everyone has a hall light that is in reach and working. We already kind of talked about soap dispensers and gloves in room. Broken equipment. What's your policy on that, though? Like, what is your system with broken equipment? I think many have gone to some form of a software and how to report that and where you place it and so on and so forth. I'd look at that again if it's been a while. Are your medication carts clean and locked? And are your med rooms locked? Oxygen tanks stored and transported correctly? Every once in a while, I'd find that person walk down the hall with an e-tank on their shoulder. Oh my gosh, no. Are your computer screens in sleep mode when unoccupied? Are your beds in locked position at lowest level? What floor signs used? But then they need to be, get out. They need to be removed when appropriate. And are your residents clear of their fire doors? Just little things that came to mind when I was writing this. Key elements to effective rounding. Well, bottom line, no matter what type of rounding or combination of rounding you are conducting, just give it purpose. Think about what you're going to do before you go out there. Have a plan and give it purpose. Round with activity in mind. This shouldn't be fault finding. Look for things, and then look for things that could be unsafe. Of course, focus on your residents. You want to prioritize prevention and educate others on preventing errors or other safety events. Observe the daily activities of your staff and give feedback in a meaningful and positive way. And lastly, assess your environment. Talking about environment here just in the last couple of slides, but go a little bit further. Maybe look at things that you wouldn't normally be aware of, or have someone else show you that so that you come familiar with looking things that might not be in your scope that you usually pay attention to. Well, we all know rounding is not a one man or woman show. You need to pull others in to help you and rely on your fresh eyes. Round on different units that you're not a part of. Oh, it's a whole different perspective. And have the IDT, have that team round in other departments. For example, you're going to learn a lot rounding in the kitchen if you're a nurse manager. It's a whole different aspect. All 3 shifts and on your weekends. You may find that your home is an entirely different work culture on Saturday and Sunday. So be consistent and prioritize rounding. Now, leadership turnover and inexperienced leaders are more prevalent than ever. So you experienced leaders, and I know you're on this call here today, be the mentors. Take your newbie leaders and do rounds with them. Show them the things that you look for. Show how you do head to toe resident is head to toe room, head to toe hallway. Do that with your new people and develop checklists for consistency, completeness, and reporting. Information from your rounding. So plans of action for areas that need improvement. Well, this can vary. Not everything needs a PIP, right? Rounding trends that you find, though, they need to be elevated. You need to start talking about it. Get information such as barriers and strategies from staff, from your leaders, from your residents. Review your policies and procedures when you find these things. Have discussions in huddles and employee meetings. Take your concerns to QAPI and develop action plans based on your root cause analysis. Some of your more complex issues, well, like I said, they may lead to a process improvement plan, but rounding should be part of your culture. Make it a priority. The types of rounding that I talked about, I mean, you can combine these, right? Or you can schedule the types based on the needs of your home. Now, the Superior Health QAPI resources here that you see on the slide, they're an essential resource for developing action plans and maintaining sustainability for the areas that you're finding on your rounding, and not just on rounding, for anything you're doing. Here's just a wonderful resource materials for QAPI. Well, like I said on the objectives, we got down here to the last one. This is where I'm hoping you're going to help me out and everybody else on the call. What are you struggling with when you're doing rounding? Is there something that you've been seeing in the last month or week that needs to be improved on or addressed, and you need help with that? That question isn't going to get you. Do you have checklists for rounding? Have you incorporated any kind of rounding into your electronic health record? What kind of rounding struggles or successes do you have? That is my presentation. So let me open up a little chat here. What do we have in here, Constance? Anything?
Don't see any questions. Just talking about start small and be consistent when you're doing rounding. Working at a facility, there could be fires that we have to put out. When we say fires, I mean like, the occurrences that can happen that we need to put out, and our residents, families, and staff anticipate the rounding sessions. So it is really important that we consistently participate in rounding, and that we have open dialogues.
And I do have a quick question for you, just because of the fact that there are there's facilities that have a culture of rounding, and there's facilities that struggle with that. And for those facilities that may struggle because you don't have a very engaged team, or they don't see the purpose of it, how do you get started with rounding? Like, what does that look like within a home?
Yeah. Yeah, Keisha, you already said about, well, no, actually it was Constant talking about starting, well, whoever said start small and be consistent. I know it sounds so simple, but kind of is. Get out there. Just get out there and make it a priority. When that staff sees you coming out there and doing rounding, and you have an agenda in your head, right, on what you're going to do. You can even make time frames. It's okay to say to someone that I wanted to get out here on this hall, see how you guys are doing. I have 10 minutes or I have 15 minutes and I'm going to go walk. I mean, just sometimes you do need to emphasize that this is how much time I have right now. I will have time for you again later, but right now, this is what I have. I know that priorities get in the way of rounding sometimes. Small, yeah, just do a hallway or just do a few rooms. Do one type of rounding. Put it on your calendar though, and commit to that. Tell somebody, I know I'm meeting you with right now, but I do have an appointment to round on B Hall right now. So we'll finish this discussion later. It's all about prioritizing, making the effort to do so, because then that whole culture, when the staff sees what you're doing and that you are involved, they're going to see differences where they're going to want to be involved and want to be part of that team. They want to be empowered and engaged. And of course, I'm up for anyone else that, whether it's one of our participants, if you have any other ideas for rounding, or if a QIA would like to add to that, that would be fine too.
I was working as a consultant the first thing I would start with in a facility is, hey, let's go do rounds together. Let's go see what I see.
Nice.
As an outsider walking into your facility, I would want to show you all the things that I pay attention to, all the things that a surveyor is going to pay attention to, whether it was going in for a mock survey or for a DPOC, or it didn't matter. I did the same thing each time. Let's go do rounds together so that people from the entire IDT would know how to do rounds together. And I'd set up um, a checklist for each department on what, if they weren't familiar with another department, such as the dietary manager, they might not be familiar with what I'm looking for as a director of nursing or as a nursing consultant. But if I can give them a list of, hey, here specifically, here are some problem areas that I'm going through, then it made a huge difference. And it helps to have eyes that aren't just yours.
Yeah, just to elaborate on that, Constance, I really did like using the interdisciplinary team approach and going into each other's departments to do rounds. And yes, we did use a checklist. But the other thing that happened was that you realized it's like on the other side. Did you ever have, like, well, there's shift rivalry, right? Remember, afternoons is always wrong and midnights is wrong and days shift is wrong and all that. And then you walk the walk and then you realize it's really, no, it's not. Well, same with like diet. Oh, the dining services, this or that. And then you go in there and you work there, or you round and you audit and you're like, oh, wow, I didn't think it was like this. Boy, they have a lot to do. It was the other thing about that. It put perspective into what the other department does. I thought that was very key.
Tabitha said, whenever I'm unsure of where to start, I use checklists. There are so many resources included in this presentation to help leaders identify where to start as well. That's true. Checklists help. I think there's things that you can't always put on a checklist, but it is very helpful to start with the checklist. And then as you get familiar with it, there may be things that you notice that there's more falls because of what you thought your root cause analysis is. And then you go and look and you find out, oh, that might not be the situation. And now I'm looking for this specific thing. So I think there's a lot to be said there.
We've made checklists too for making checklists for your survey prep based on, what was the last survey? What kind of issues were, did you have then? Plus things that you're seeing for the survey coming up based on your quality measures, your fries, those type of items where we made checklists for everything in regards to rounding because it had to be purposeful, right? We all had to be consistent and purposeful in what we're doing.
And don't be afraid, like when you're rounding, like let's say you're rounding with your leader or you're rounding with some of the frontline staff, they are going to point out things that you might have missed. And so, and welcome that. I remember rounding with one of my dietary managers and a staff member that worked in the dining services as well. And I checked I thought I checked all the milks and so forth and had the dates and then said, okay, if everything looks good. And then one of them came up and said, you know what, you missed this one and this one's out of date. And it was, oh, you know what, I'm glad that you saw it. So just being able to round, and they are going to hold you accountable to that rounding as well.
I had an activities coordinator that identified that our wheelchair bound residents couldn't get into the bathrooms to wash their hands. Something I should have known, something I should have been able to assess, but I was so thankful for their ability to notice that she was already trying to work with them on hand washing, which is nursing, but activities was working on it and they couldn't access it. So we had to set up hand washing stations for them.
Good catch. Very nice. Very nice.
Are there any other questions for Ms. Kim? I'm looking at the
All of you
chat.
leaders out there, do you do rounding? What kind of rounding do you do? Do you like rounding? That would be one too. What if you don't like it? I want, you know what I mean? It's just sometimes somebody
Yeah.
might be like, yeah, I don't know if I never make time for it. It just seems, I seem lost, overwhelmed.
I don't see anything in the chat right now. Feel free to unmute and speak if you want to. Otherwise, you can put it in the chat. Are there any resources you guys could use for rounding? If you can think of something that we could point you in the direction of.
A few of my references. I will say that the CWAPI Leadership Rounding Guide is a good one right there at HRQ, if you want to take a look at that one.
What are you doing to get buy-in from other departments to help you with rounding? Cheryl asked. How do you get other departments to help you with or buy into the rounding is the question.
Oh, well, you know what? It might actually, Cheryl, go back to kind of what I had said before. Do you have any of your own experiences with the interdisciplinary team, you know, going into departments? Because I mean, if you don't, you can even make it up and use mine, because I was delighted to go and learn about, you know, like about the kitchen as the director of nursing and the ins and outs, because you're not just rounding, you're also maybe put it more as a learning opportunity. Yeah, you're doing some checklists and rounding. You're not going in and this looks wrong, but you know what? I want to get to know more about the departments, each other's departments, so that we can understand each other better. Okay. So maybe that would be a good approach to get rounding done. It's kind of twofold. I get to learn, but you also get to see things with fresh eyes. Maybe they didn't even notice something and you went, is that right? Because it doesn't look right. And they'd be like, oh my gosh, you never saw that before. Maybe try that approach.
Do you do rounding before you come to your stand-up? You guys, most facilities have stand-up every morning. I always completed my rounding, not only throughout the day, but I also wanted to complete rounding just to get updates from my staff that I could bring to stand-up. So are you doing rounding, walking rounds when you do stand-up? I don't see any more questions or answers in the chat at this time. So our Nursing Home Leadership Roundtable for 2024, we're excited to present that we will be having our focus will be on turning deficiencies into efficiencies. You can scan the QR code to learn more and register for the roundtable. I did say that it was sent out. We will have special limited edition series scattered throughout the 2024 schedule. It's designed to provide an in-depth guidance and interactive learning and practical strategies to meet regulatory standards. We're reserving the second and the fourth Wednesday of the month to learn from subject matter experts, your peers, and the Superior Health Quality Alliance staff to work on the most popular F tags that we presented in our series previously to gather information about. We're excited because we get to work together to turn your deficiencies into efficiencies for 2024. We're really, really excited about the program. I want to thank Kim for presenting on this topic. It was a fabulous presentation that you gave us all in a day's round, where we enjoyed taking a deep dive into rounding. Before we conclude, I want to remind you that there is a event valuation in the comments section. If you could please fill that out, it helps us to learn more about how we can improve, and we take that back to our group to discuss. Continuing the conversation in Superior Health Connect, there also is a slide on that. We can connect as a shared learning environment for Superior Health participants to come and foster and promote an all teach all learn climate that provides the framework to improve and sustain mutual health care quality improvement initiatives locally, regionally, and nationally. There's also a QR code that you can scan to join that Connect. We appreciate you coming today and have a great day.